When someone is diagnosed with cancer, it's just the very beginning of a multi-part journey. There's the grief, the treatment, hopefully the recovery, and then survivorship. Now, what does this mean and why is it essential? Survivorship Nurse Practitioner Katy Clarke from Arizona Oncology joins me with the answers. Thank you so much for being here today.
Good morning.
Such an important topic, and it's a tough topic at the same time, although one of positivity in some ways too, and optimism. So first, I guess we should define what a cancer survivor is.
Well, thank you for asking that question. It's a misconception that cancer survivors need to be cured or maybe live for so many years after their diagnosis. But actually, if you have had a diagnosis of cancer, you are a cancer survivor from that moment until the moment you die of any cause.
That's a good way to put it. And on that, there's something called cancer survivorship.
Correct.
What does that mean?
So we have built a program at Arizona Oncology to really help our cancer survivors live the best life possible. Now, actually, cancer survivorship can look very different from one survivor to another, but we're able to focus on what their pertinent health issues are.
There's many definitions for it,
exactly,
as we were talking about earlier. And what is your specific role in working with these survivors?
So I'm a nurse practitioner, and I meet with them at some different phases of their journey. The average patient's probably someone that has been wrapping up their chemo, their initial diagnosis, and I give them a care plan to help them refer to in the future any details of their diagnosis, their planned follow-up, and any general health recommendations that we have.
So you're a counselor in a way.
Exactly.
I mean, you're sort of guiding them through it. You're the expert in it, and you're letting them know this is what's going to make your life better from here on out.
Yes.
What does a typical appointment look like when someone comes in to see you?
So we review that care plan together, and that's really important because I want to be able to personalize it to the patient, but we go over kind of where they've been, so what their diagnosis was specifically, answer any questions about that, the treatment that they had. We discuss long-term health risks. Unfortunately, some of the cancer treatments do convey an increased risk of cardiovascular disease or perhaps secondary or unrelated cancers. And then I'm able to really address their specific, maybe ongoing symptoms or some concerns that they have related to their cancer diagnosis and treatment.
And among the benefits to the patient, one of them could be preventing the cancer from returning, right? Living by these guidelines, if they were able to beat the cancer, can prevent the cancer from coming back.
Depends on the situation, but sometimes there are tools that they can use to improve their health that will improve their overall chance of cure. There are situations where perhaps they need to take a maintenance treatment or a preventative type of treatment. And having our program will help hopefully with compliance, or adherence is probably a better word. And we also know that quality of life is so important. So if they have the tools to really live the best life possible, then I feel like I have made a difference.
Right, I was going to say the benefits really are not just physical and not just health-wise, but also talk about the importance of psychological health and how this helps that.
Absolutely. So many times in a quick visit with an oncologist, there isn't always the resources to fully address perhaps relationship issues, intimacy issues, some of those more complicated psychosocial concerns related to cancer treatment. So I really try to create a space where my survivors feel comfortable bringing all that forward to me.
Well, and again, it's a private session, right? Just like all other doctor visits.
One-on-one.
It's patient-doctor confidentiality is the word, I guess.
Absolutely.
And so in the last minute or so we have left, you know, of course, the cancer patients and cancer survivors have a great support group around them. They have their family, they have all the doctors, the oncologists, et cetera. What advice would you give the families of these survivors, of these cancer patients, to sort of assist in this journey and help the oncologists like you, or the nurse practitioners, the survivorship nurse practitioners, help them on their journey?
Well, caregivers, family, friends, they are all so important. And we do have some specific literature and support groups that really can help them with those tools. But honestly, listening are great skills to just really provide a space where their loved ones can kind of bring forward their concerns, and they can be that support system, be that rock for them. And there are plenty of other people that are experiencing the same things, so we can help through our clinic, or the oncology practice can help connect caregivers to other caregivers who are going through some of the same experiences.
Well, having that entire group supporting them makes all
really
the difference in the world, and having compassionate people like you who really inspire that optimism is really what's going to help them heal, and what makes them a survivor is people like you. So thanks for joining me here today and telling us a little bit about what you do.
Thank you so much for your time.
Definitely. Now, to learn more about the cutting-edge research and clinical trials taking place at Arizona Oncology, call 1-855-784-HOPE or visit ArizonaOncology.com.